Although the Michigan State Senate passed House Bill 4714, expanding Medicaid to hundreds of thousands of low-income adults, it might not be put into law until well after the January 1st deadline for federal funding. The Affordable Care Act measure initially failed with a 19-18 vote as one senator opted to abstain. Senators then approved a motion to reconsider and voted again 2 hours later to pass the bill with a 20-18 tally. Senator Tom Casperson changed his vote to yes after his amendment was approved. The added wrinkle ensures that residents without health care coverage won't be charged an exorbitantly higher rate than their card-carrying counterparts at hospitals.
I voted no and ultimately sat down with the director and others and shared concerns. And so my concern is northern Michigan, not just the UP, but northern Michigan, the rural areas. We're struggling up there, and that's been shared with me by my people overwhelmingly. And so that was a conversation the director and I had, and I wanted to see more done on their behalf. If I'm going to take this vote, they need help.
After the bill was formally passed, Casperson and 23 state senators from both sides of the aisle voted to give the law immediate effect, just as their colleagues in the House had done back in May, allowing the Senate to meet the January 1st federal funding deadline. But in order for an immediate effect to pass, it needs 2/3 majority vote.
For a bill to have immediate effect means that as soon as the bill is signed into law, that new law takes effect. If it doesn't get that immediate effect, it can't take effect until 90 days after the start of the next year. And so by not giving this Medicaid expansion program an immediate effect, it means that we are left with a program that's simply stalled until next April. And as the Department of Community Health has told us, for each day after January 1 next year that this program isn't running, Michigan loses out on $7 million every single day. And so if we're looking at 90 days after the start of the year, that's $630 million Michigan would lose out on unless the Republicans do the right thing and come back and give this immediate effect.
Because the Republicans currently hold the majority in the Senate, they are the only ones who can motion to reconsider the immediate effect vote. The window to do so is closing, as the Senate will reconvene next Tuesday, September 3rd, at which time they can send the bill as it is back to the House so they can affirm the new amendment. If the House approves the Healthy Michigan Plan as is, without immediate effect, and Governor Snyder signs it, Michigan and the 320,000 people affected by the measure will miss out on 3 months of federal funding.